Hello, everyone. I'm Danny Bravo Alvarado, and I'm gonna talk about our discussion for week two for our sports um, medicine class. And so the first question was outline three components of an effective EAP plan, and my three are the immediate recognition and assessment of the injury. Number two is the efficient communication with your team. The third one is rapid emergency response and transportation. And so, with the first one, the immediate recognition and assessment. Number one, you pretty much have to recognize the severity of the injury, and that goes through assessment. And you are either assessing um, uh, you're going through the assessment protocols, and that's going through the standardized procedure to evaluate the injury, and that's making sure that the injury that the athlete is breathing, um, having their blood circulation, testing for their blood circulation, and also their response when you are talking to the injured athlete. Um, this will ultimately determine the appropriate course of action that needs to take place to make sure that the safety um, the best is done to try to save that athlete, especially if they're under an extreme emergency um, or the severity of their injury as well. Um, and that goes with having a pre. Um, this will ultimately lead off to my second component, which is having designated roles around your team. And that's one of them can be testing for, the blood circulation. The other one could be testing for the oxygen, making sure that they are responding, or if one has to immediately call 911 or have the spinal boards available for that athlete. And ultimately, this leads off to number two, which is the efficient communication with your team. So having those established clear lines of communication between both parties, whether that may be you and your team or the opposing team as well. Um, and having the availability of emergency contact, whether that's EMS or the hospital personnel that's nearby. Um, and having that designated person call 911 if necessary. Um, and this leads off to my number three, my component number three, which is rapid emergency response and transportation. So the necessary action needs to take place depending on the severity of the injury, whether that be first aid that needs to take place or that CPR that's required, and having that designated person doing that is really crucial in acting fast when certain events like this happen. Um, and so. Um, you also have to ensure the availability of these different equipments, making sure that everyone knows where all these different types of equipment are located in the facility, whether that be the oxygen machines, the AD machines, the spinal boards, making sure everyone understands um, where all these different equipment is located to be able to um, quickly determine the situation, whether they need to uh, get a, go to the hospital and whatnot, and also with that, also understanding the emergency routes and where they're located to be able to safely and rapidly transfer the injured athlete as quickly out of the facility as possible. And number two is what unique challenges do sports venues present, and that goes with the crowd control, communication to the crowd, the evacuation routes, the size of the facility, and then also the weather conditions or the environmental conditions that um, that are happening during the event. Just in the case of Hank Gathers, where when he collapsed during the game, his family was quick to respond and were, trying to get his immediate attention or trying to attend him as best as possible. Those are some of the aspects or some of the difficulties that are going to be faced. And so that's where crowd control is extremely crucial because the experts need to be able to do their job as efficiently as they can without any distractions or anything that's kind of opposing that. And that could be with the crowd control. And so, so these things are gonna happen, and so just being prepared for that will ultimately help the experts try to do their job as best and efficiently as they can. And number three is imagine you're part of the medical team that responded when Damar Hamlin collapsed during an NFL game in 2023. How might the experience emotionally and spiritually affect you? How could those emotions influence your actions in future emergencies? Um, Ultimately, for sure, 100%, you're going to feel that emotionally and spiritually crisis happening all at once. But as the athletic trainer or the medical personnel there, you really kind of unfortunately have to put that aside and have those quick decision making and trust in your expertise to be able to try to save that individual as best as you can, and try to save that afterwards with the team. Um, but definitely, these emotions can influence your actions in future emergencies through being prepared. Um, through this experience, knowing what to expect, especially if something like this happens. And so, reflection is key, and having that emergency action plan will definitely help with these future emergencies and help to best efficiently execute the plan as best as possible. And so, going with number four, as a coach, athletic director, athletic trainer, or educator, how do you rebuild a sense of safety and unity to the catastrophic incident? How do you support and manage athletes who feel guilty for playing after witnessing their friends and teammates collapse? So, um, as a coach, you know, I know everybody from the team is going to look at you for guidance. And so, either the course of action has to happen, you have to have those quick decision making. But I think ultimately it comes down to the guidance that you give your team, to the emotional support that you give your team, and just having that open communication with them as well. I think these points are going to help with trying to get over the hump, especially if you have to continue playing after something like that happened. And I know it's going to be hard to try to put that aside for the moment and finish the game, but ultimately, one has to take to account that these things can happen. It's realistic, um, but getting through it as best as you can, and then afterwards having that open communication, debriefing the situation, going through the experiences, um, the emotional standing that everybody went through, and pretty much just bonding with everyone and trying to come down to a conclusion, and just having that support system would ultimately not kind of overpower the situation, but just try to get through it. And just, you know, relying on each other. And just knowing that everybody is a team, it's unison, it's unity, and just being able to express emotions, because we're all human beings, and we're all emotionally driven. But being able to let out those emotions is really critical when it comes down to supporting your teammates, especially when a catastrophic incident like this happens. And so I think all these components have a key crucial role when it comes down to guiding your team and pretty much trying to get through a situation like this. Um, but yeah, hope you guys enjoyed that that explanation. Thank you.